January 9th, 2025 meeting of the Fitchburg Board of Health. I now call this meeting to order. Please be advised that FATV is conducting an audio and video recording of this meeting for public broadcast. I ask that anyone else in the audience who is recording this meeting, please identify yourself for the record now, if anyone is, and stand and state your name and city of residence. At this time, I ask that all electronic devices be placed into silent mode, including mine, I think, and we'll begin the meeting. Anyone who wishes to speak, please approach the podium, identify yourself by name and address, and identify the agenda item on which you would like to speak, and then you may speak on it for no more than 2 minutes, although we ordinarily end up stretching that time, I think. I think actually the first items on the agenda have to do with housing, and I think they're both going to be remote, if I understand.
The housing is actually not remote.
Not, okay, then the local upgrades.
Involved were told 415, so
okay.
We do have a property owner here, but we do not have the petitioners here.
Is this the Title V local upgrade? Is that going to be first?
That's the first item agenda. Did you want to do the public comment first?
Sure, we can do that.
I do have a public comment, but it's on the Opioid Settlement Fund hearing, so would I give that comment during the hearing?
You could, but that's probably not a bad idea.
Okay.
Because there's a little bit of there's a presentation that goes along with it, so it might answer some of your questions and might create new ones, so that's probably not a bad idea. Yeah.
Okay.
I didn't get that. Could you try again?
Oop, that's me. So then, are we going to do the local upgrades first then on the...
Sounds good to me.
All right.
Which one's first?
Jack Maloney.
So it looks like we have Chris McKenzie subbing in for Jack Maloney. Can you hear me, Chris? Unmute yourself, Chris.
Chris McKenzie.
Chris McKenzie, we don't hear you. You're muted on your end.
So far, we agree with everything you said.
How about Evan? Evan, are you there?
I am here. Can you hear me?
I can hear you. So maybe we can skip to the second item while Chris McKenzie, I'll work on Chris McKenzie's issue.
Okay, so Evan Carloni has a septic design for 11 Bennett Road.
That's correct.
All right, great. I can take it away here. I'm here on behalf of the owners of 11 Bennett Road in Fitchburg. It is an existing single-family home with a failed septic system. The replacement system is going to be the same bedroom count as what is existing there today. And we have a... Oh.
Sorry, we lost you, Evan.
We can see you, but we can't hear you.
I hear you.
All right, there we go. I got promoted.
Yeah, I promoted you so you can share the system if you're
Great.
you're okay to do that.
Yes, I can do that. I will get that up right now. All right. Can everybody see that okay?
And I can give you a paper version too.
Oh.
So
I'm giving you the right one. This is Sheldon Road. She has.
Yeah, we can make it out, I think.
Okay, here, I'll do this.
Go ahead.
I can zoom in a bit too here. So
Awesome.
there we go. So 11 Bennett Road, existing single-family home. We are replacing a failed septic system. We do have we do have some wetlands that are surrounding the property here. We've kept the system outside of the 50-foot buffer zone. That's about the best we can do on the property with the utilities that we have running to the property from the road. The system that we're proposing to use here is a Presby EnviroSeptic. The Presby EnviroSeptic does receive a 2-foot offset to the water table via the approval letter for remedial use. So as long as we're keeping the same bedroom count, they do allow for that reduction. What that reduction does for us here is it allows us to maintain a gravity-fed system from the house, the tank being out back, and then we run down the slope here, coming off the back of the driveway. So what it allows us to do is maintain gravity-fed system, eliminates the need for a retaining wall. It also eliminates any additional fill encroaching on the wetlands and also the driveway. So that's our one request tonight, is the 2-foot offset reduction to the estimated high water table from the bottom of the Presby system.
What was the reason for the failure of the system initially?
The leach field has failed, so it's in hydraulic failure. It's got biomat, and it's not uncommon for an older system to run its course. Well,
Steve, do you have anything to offer or any reasons why?
Just out of curiosity, and Evan, by granting the LUA, what type of dollar amount expense would you estimate the LUA saves this system?
Well, so right out of the gate, without having completely drawn up basically a pipe and stone field that's a full 4 feet from the water table, but right out of the gate, I know you would save on a pump chamber. So a pump chamber, it depends on what's existing in the panel, the existing panel inside the house. But if panel doesn't need to be upgraded, it would be a little less. If it does need to be upgraded, a little more. So, but that's typically, I would say, anywhere between $3,000 and $5,000 for that. The Presby system also has a bit of an advantage over a pipe and stone system in that it doesn't require a 5-foot over excavation, which is costly. So a Presby system and a number of other systems are able to basically dig out the area for the leach field, but you don't have to dig out 5 feet all the way around and replace it all with Title V sand. So that's at least a couple $1,000s in savings there as well. That's not commenting on whether or not we could finagle something without a retaining wall or not. Retaining walls can be costly, so there's at least a few $1,000s in savings with this system.
I just wanted to make sure the board members understood that.
Yep.
And I'm sorry, as far as the retaining wall goes, you say you are going to try to do without it, or you will be using one?
This configuration does not require a retaining wall.
So that would be an additional saving for the homeowner, I think.
Yes.
Yeah.
Yep.
Well, I don't think, at least certainly I don't see any particular problems with what you've requested, so I would make a motion that we approve the reduction in separation that you've requested.
I have just one question. Would the retaining wall have had to be built using a different system because of the wetlands in the neighborhood or in the area?
So it would be due to the breakout elevation of the leach field. So the Presby being 2 feet lower than a pipe and stone, and also having a breakout elevation that is lower in profile than a pipe and stone, allows us to make breakout with grading, where a field that is higher and also has a higher breakout elevation, we would end up with fill to make breakout that is quite a bit, that would be without a retaining wall, would end up encroaching far greater than what we have here on the wetlands. So yes, that's basically it, is we would likely need a retaining wall to ensure that we don't end up filling into the driveway and filling a lot closer to the wetlands.
Okay. I'd second the motion to approve that.
And since one of our members is missing today, I think it's unanimously approved then.
Thank you, Evan.
Thanks a lot.
Great. Thank you very much. Have a great evening.
Yep.
You as well.
Good luck with it.
Thank you.
We can skip over to Chris McKenzie.
Sure, yeah, I was going to say we could go back and give Chris another try.
How you doing there, Chris? Can you hear us? I'm going to promote.
Maybe he should join Evan. See if...
I didn't hear it.
I didn't hear what...
Come again?
Oh, there's someone. They're on the phone. Is that Chris?
Oh, we got Chris. Oh, he's on a line.
Not hearing him, though.
How about now? Can you hear me?
Yes,
can
there
hear
we go.
you.
I got to figure out what's wrong with my microphone, I guess. Apologize for that.
No problem.
Not sure what was happening. If possible, if you'll allow me to share my screen.
I have made you a panelist.
Yeah. And all right. So this is an existing house located at 299 Sheldon Road, existing 3-bedroom house. We've proposed a conventional system. I heard Evan speaking about a Presby system. We've got a conventional system here that we're proposing to replace the existing failing system. A new pump chamber and septic tank will be installed down here by the house. Pump chamber will pump it up to the backyard out by the existing shed. That gets us outside of the 100-foot radius from the well located here. So as part of that, we're going to ask for a couple of local upgrades. One is regarding, I believe, the depth of material. We don't quite meet the 48-inch, the 4-foot depth of pervious material requirement. I think we're somewhere around 40 inches total. And then we're also asking for the local upgrade approval for a reduction from the groundwater offset from 4 foot to 3 foot. This will allow the system to fit into the location a little better and fit into the existing grading fairly well without too much alteration of the existing ground. There'll be a pretty good mound there. Other than that, that's really all we're asking for. Not a whole heck of a lot here, but certainly an improvement over what was there before.
And I'll ask the same question I asked before. What was the reason for the failure of the current situation or current system?
I'm not 100% sure of why it failed. Just from what I've seen, it looks fairly small. I don't know what caused it to fail. It's also less than 100 feet from the existing well. Just barely 50 feet from the existing well. So obviously that's not a good thing either. But I don't know the details of what transpired causing the failure of the system.
And who makes the determination that the system's failed? Is there an inspector who goes and looks at that to make that decision?
Yeah, the Title V inspector would go out and do that. I don't know if this system's been officially failed. A lot of times systems are just assumed to fail and are upgraded as a result of that. Typically, those reports are submitted to the Board of Health, so I don't know if Steve has anything to say on that, if they have any record of this system having been inspected or not.
Okay.
Yeah, I think this was assumed it was going to fail. I don't recall seeing a Title V report.
And just
I don't have anything.
Go ahead.
I was just going to say I don't have anything in my files that show that a report was done.
But I guess it is in danger of failing, so this change or upgrade is being requested. Just hypothetically speaking, if we were to say, no, we're not going to approve this, what what options would be there? What alternative would you have?
You're talking about the variances that we're asking for?
Yes.
Well, as far as the depth of material, there's really nothing we can do about that. That's what's out there in the ground. So there's nothing we can do about what's existing in the ground. I think that's why the state allows for these local upgrades to happen. And as far as the groundwater separation, we'd have to raise the system, and it would cost a few $1,000s more to build, because it would just be a lot more fill brought into the site, and it would affect a larger area as well. So there would be more of an effect on the property.
Yeah.
It already requires a pump because it's located uphill from the system.
Yeah, I wasn't contemplating not allowing it, but I was just curious what other options there might be if that were to happen.
Yeah, there really aren't any. This particular site is pretty far out of town, so it's not connecting to the sewer would not be a possibility.
Right. Well, again, I don't see any real problem with what you're requesting, so I would make a motion that we approve the requested upgrades to the system, or variances to the system.
I'll second that.
And you've gone silent again, so either you're stunned by our answer or...
Were you talking to me?
Yeah. There you go.
Oh, I'm sorry. I didn't hear any questions or anything.
No, we just made a motion to approve your requests for the upgrades and variances.
Okay.
So thanks very much.
Thank you. Thank you very much.
Thank you very much, Mr.
Hope everyone has a good evening. Thank you.
All right, thank you.
So I think that takes care of the upgrade requests, and we would move on then to the hearings, I think. Is that?
I don't believe we have the petitioner here.
The number one on the agenda is again continued, right? The O'Farrell one?
That's correct.
Yeah.
We could jump around on the agenda if,
Is the number two the petitioner who's not here currently? Is that it?
yeah, Ms. Walsh, I do not see. I do see Ms. Maury. She is the property owner, and everybody else is something to do with something else. And Inspector Domain and Assistant City Solicitor Pollock are here for that hearing.
So Sheena Walsh is not here.
That is correct.
Okay.
Let me look into Cheryl Sabara and see if their crew is ready. Maybe we can do a presentation early. I told them 5 o'clock, but I do see them on the...
Well, as far as the opioid settlement goes, I think we have individuals here who wanted to speak on that.
Right, but I want to make sure that everybody is present that has input on that.
Okay, not everyone is here.
I have Cheryl Sabara from MAHB. Cheryl, can you hear us?
Yes. Can you hear me?
I can hear you.
Okay.
I want to thank you for attending. I don't know if you and your folks are ready to present yet, but it sounds like...
We are.
Oh, you are?
We are. I am here with my colleague, Carly Britton, and we are both ready, if you're ready for us.
I'm going to give Carly permission. Did you want to have Ms. Wetchy give her comments first, or do you want to hear the presentation first and then present?
Well, I would ask her. Do you want to make your comments first?
Well, I saw a draft of what you're proposing to use the funds for, so if it hasn't changed substantially, I can give my comments. I don't think we should be using the substantial sum of money on government salaries. We should be using it to help people who have substance abuse problems. Looking at some other localities, the state of Alabama is using their opioid settlements for what's known as grand families. These are grandparents who are raising their grandchildren because the parents are addicts. I think that's an excellent use of the money. I know in Western Massachusetts, I believe it was in Greenfield, they took a survey, and the number one need that people felt was for housing for people in recovery. Unfortunately, in December 2023, Opportunities for Hope, which is run by the Fitchburg Housing Authority, kicked people in recovery out of Elizabeth House, a shelter in Fitchburg, to make room for migrants, kicked them out in the middle of winter. There is insufficient housing for people in recovery. That's another need that we have. We should also be using these funds to provide direct detox and rehabilitation services rather than on people who are essentially middlemen and middlewomen and don't provide direct medical services to the population in need. Unfortunately, in this country, we don't have a single payer system. We don't have treatment on demand. I know that years ago, I had an addict who I cared about, and he went for treatment, and he relapsed. He went a second time. He relapsed. He went a third time. He relapsed. He wanted to go a fourth time. He couldn't because he had no insurance coverage. So these are the things I think we should be using the money on. You don't have to throw a lot of money at government salaries. One of the most effective programs out there to treat addiction is Narcotics Anonymous, which is a volunteer organization. When you look at what we are paying the people in our outreach team and you compare it to people on say, Recovery Centers of America and next door Westminster, our people here in the city of Fitchburg are making twice what the people at RCA are making. It's a very bloated, wasteful use of our opioid settlement funds when they should be used for the people in need and the families of the people in need. Thank you.
Thanks. I will say you didn't introduce yourself, but I think everyone knows you, so we won't insist on that. Thanks. All right. Shall we then go ahead with the presentation? And if you have additional comments afterward, certainly welcome to make them. Cheryl, then.
Hi, I have some slides that I sent over earlier today.
I apologize, Cheryl. I had meetings all afternoon, so I didn't get a chance to look at what you have, but I can promote you to a panelist so you can share it, if that is okay by you.
Sure. Carly, do you, let's see.
I should have what you sent, if you want me to pull those up instead. Yeah, I have them pulled up now, so Steve, if you want to make me a panelist.
On the way.
Okay.
Thank you so much.
And while Carly is doing that, I will just introduce us to you. I am Cheryl Sabara. I am the Executive Director and Senior Staff Attorney for the Massachusetts Association of Health Boards. We are a membership association made up of Board of Health members throughout the Commonwealth, and we provide legal education and technical assistance to the 351 boards of health in Massachusetts. MAHB is a member of the CARE Massachusetts team, which is a team that Carly will describe in greater detail, but we are here to provide technical assistance and training to municipalities that have agreed to, in exchange for money that they've received from the opioid abatement program, they have agreed to look at evidence-based strategies and implement them with the money that they have received from the settlement that the AG's office made with the defendants. So Carly, I am an expert on the legal piece of this, in the determining, what agreements you need in place, where the money is located, how to access the money, and how to set up collaboratives if that's what a city or town wants to do. My understanding is that Fitchburg is looking at strategies that will be Fitchburg focused. And Carly is a content expert on opioid use disorder, and she will explain her background in a little more detail. So I'm going to turn this over to Carly right now.
Great. Thank you, Cheryl. I will go ahead and pull up my slides and introduce myself. Let's get those up there.
Dr. Ogdazarian, if I may interrupt for one moment. The petitioner for the housing hearing was notified to appear by 4:30. I know that Ms. Maury is interested in that case, and also Inspector Delmain. At what point do we draw the line and say that hearing is not going to happen, so these folks aren't sitting there wasting their time? Maybe we give them till 4:45 and call.
They're waiting for the hearing.
They're waiting for the hearing.
Yeah, I see. Okay.
And the assistant city solicitor is also involved with that.
Okay. And it's Sheena Walsh.
That is correct.
For whom we're waiting, and she has not come.
That's correct.
And she was told 4:30.
She was. I just double checked.
Yeah. Well, would those who are waiting be willing to wait another 5 minutes till that would be 15 minutes past the time, and if she hasn't come by then we'll let you can sit here if you like, but probably have other things you'd rather do. So do you mind 5 more minutes? And if she doesn't come by then, we'll postpone that hearing to another time.
Sounds good. Thank you.
Okay. Sorry for the interruption.
Sorry for the interruption.
Carly.
Okay, great, no problem. So my name's Carly Britton. I'm part of the CARE Massachusetts team. And I'll go to the next slide so I'm not kind of repeating myself. I do have slides on what CARE Massachusetts is. So the objectives of our presentation today is to introduce what CARE Massachusetts is and what we do. We're going to present a summary of the opioid settlement and abatement priorities. We'll review the requirements for towns and cities as part of the settlement process, and we'll share some examples of evidence-based practices that you could support with your funds. So what is CARE Massachusetts? We are funded by the Massachusetts Bureau of Substance Addiction Services, which we'll call BSAS, and we work collaboratively with cities and towns across the state to take action to end the overdose crisis. So we were specifically put together to support municipalities for the opioid settlement funds. That's sort of our specific focus, is to provide support around the planning process and the use of these funds. So we provide resources and technical assistance with connecting municipalities with the people most impacted by the overdose crisis. So sometimes these funds are the process has been handed off to a group of individuals in the town that really don't have those connections. So we help link you to the individuals that may be able to give their advice and opinions on how those could be most useful. We promote the selection and implementation of proven public health strategies. We educate the public on the source and purpose of the funds. We facilitate collaboration across municipalities. So we really promote collaboration and pooling funds together with towns that are, in proximity. It can be more efficient use of funds, especially if a community has not that much. The funds are a smaller amount per year, and it would be hard to really make a big impact. So if, to pull your funds together. I do come from an addiction research background in public health. I work at Boston Medical Center, and I've recently been leading a study that worked with municipalities across Massachusetts to reduce opioid overdose deaths by developing action plans and implementing evidence-based practices. So I draw on that experience when I speak with municipalities. We have individuals also that have more municipal government experience, you know, kind of like working through opioid use disorder in towns and community engagement background. And then, of course, Cheryl and her team have more the legal experience. So there's a team of us that if I can't answer a question, I usually have somebody that I can refer you to. So just a very brief history of the opioid settlements. Back in July of 2021, the Massachusetts Attorney General announced that the state's participation in a $26 billion nationwide resolution with opioid distributors and manufacturers. So this initiative really was led by the Attorney General's office, and we are here to support you in your work. So the settlement resolved claims that these companies engaged in misconduct that enabled and perpetuated vast increases in opioid overdose dispensing and diversion. So these companies were accused of having unfair and deceptive sales tactics, failed to monitor suspicious orders, and they avoided their professional responsibility. So this is really a key point when planning on how to use your funds, that you want to make sure that you are recognizing where these funds are coming from. They're coming from the kind of the bad sort of operations of these groups, and the funds should be used to kind of rectify the results of that. And Massachusetts is going to be receiving over $900 million, and those funds are for prevention, harm reduction, treatment, and recovery over an 18-year period. So towns across the state started receiving their funds maybe like 1 to 2 years ago, and the funds will keep coming in over the next up until 18 years. Some of the funds were front-loaded, so they may be getting a little bit more in the first few years and less in the out years. And also just to note that some of the funds went directly to the state, and they have developed an advisory committee on how to spend their funds. And then the rest of those funds were given to each individual town and municipality in Massachusetts that agreed to sign on to that. And those amounts do vary. Some towns are getting only in the hundreds, while other towns are getting, hundreds of thousands per year. So the state subdivision agreement is the document that really kind of just lays out exactly how these funds should be used. This agreement is available on the Attorney General's office website for anyone to look at, and it was signed by all the participating municipalities when they agreed to the settlement and to take on the funds. So in signing that document, municipalities are agreeing that they'll spend the funds within the 7 strategies listed in the state subdivision agreement, which I have a slide on in a minute. They are agreeing that they will center lived and living experience and center equity. They'll submit an annual report if their community or pooled communities have received $35,000 or more in that year. The prohibitions that are made in that document are that you cannot supplant funds for a program. So if the town was paying for something already in their budget, they can't decide to divert those funds somewhere else and take the opioid abatement funds to pay for it in its place. They should use the funds they can't use the funds for non-opioid related expenses. So you really have to be able to demonstrate that the program or the expense that you're incurring is related to opioid use. And another point that's not on here is that you can't use these funds to pay for something that the state is already paying for. For example, if it's covered by Mass Health, you can't, use these funds to pay for that service. So these are the 7 strategies that are listed in the subdivision agreement, and they really represent a whole continuum of care for people that use drugs or have used drugs in recovery and supporting their family and loved ones. The first one on the list there is to enhance opioid treatment disorder. Again, this is not, to kind of pay for things that could already be paid for through Mass Health, but really to make it easier for people or kind of add on wraparound services that aren't, sort of covered by insurance. Support people in treatment and recovery to make it easier for folks to stay in recovery and for people to stay in treatment. to facilitate connections to care. So this one, when you read a little bit more about it, it's about linking folks, say from the EMS or fire, ambulance services into care. So when other municipal departments kind of encounter individuals with addiction or, with substance use disorder, they'll be able to link them to care and to promote harm reduction. So this is things, like Narcan, just supporting people that are using drugs so that they can, live as healthy as possible. Support the needs of criminal justice involved individuals. So this could mean, having a program when people are getting released from jail and re-entering into your community, making sure that they have the support and the resources that they need, because this can be a very high risk time for overdose when people are being released from jail. And also another high risk time is for pregnant and parenting women. So a lot of, support. A lot of support is available for pregnant women, but there often aren't enough addiction-related supports. So this is also a population that could use some extra help, and also to prevent the misuse of opioids and implement prevention education. So kind of some overall approaches that we recommend that it comes from the Attorney General's office and the Department of Public Health, is that you create a diverse coalition or committee to guide the process and make funding decisions and pay people for their time. So if we encourage you to not just have municipal employees that are making these decisions, but that you bring in members of the community. And if they're not doing this work, as a job, pay them to come to meetings or, to participate in things. Pull your funding on a regional or sub-regional level. This is a very important thing to consider for smaller towns or towns that aren't getting as much money to be able to still offer services to your residents. Partner with direct service providers. So, finding out who is already doing the work in your community, seeing what they need, and seeing if they could use some of those funds to enhance the services that they are providing. They could be trusted groups already doing the work, and so it makes sense for them to continue doing their work, but maybe being able to enhance their offerings or reach more individuals. Focus on unmet needs in the community or region. Again, this is kind of around the supplanting topic. If you already have funding for something, don't use these funds for that. We really want towns to be adding on and enhancing services. So really not just keeping things steady state, but looking for ways to do things you haven't done before. And ensure that you're selecting strategies that are evidence-based. So the agreement does list specific programs, but we can also help you with that. If you give me a call, we can walk through some things that make sense based on what your needs are, and using the resources available. So BSAS has a data dashboard where you can look at some of the indicators for your town, and then us at Care Massachusetts. We generally just, for your information, how we work is we will have a call with the town or whoever the individual is that's working on this, and go through an introductory call, and then based on that make recommendations and have future follow-up after that to help support communities. So here's some steps around pre-planning, and I believe the Board of Health has done some of this already, if not all of it. We had a call earlier this week, but so you're first going to want to determine the municipal planning team and structure. But the CEO of the town has the ultimate responsibility for these, and usually that's a mayor or a select board chair, but they really shouldn't be the single one person making these decisions. So that person should, create a task force or create a committee, or perhaps, delegate this to the health department, a board of health, or some other community development group within the town to do this work. And that, we have that group, and you need to have kind of a process for how you're going to make decisions, and how whether or not you want to pull funds or work within your public health excellency grant, if you have one of those. And another really important step is to identify where the funds are and the fund type. So this is something we've heard a lot from communities over the last year. I think it's got settled out over the last 6 months, but prior to that, there was a lot of confusion and just sort of like difficulty in accessing the funds just because of the way the legislation was written and how the funds were coming in and where they were stored within the town financial system. So that has been straightened out, and I think most towns are very clear now. They have a process where the funds can be more easily accessed and used in determining the funding to date and approximate annual funding. So that's another thing, just in terms of your planning, you're going to want to know, like, well, what do we have now, but what are we going to have in the future? Those numbers, I'm going to be honest, those numbers can change, but you still need to kind of look at what data we do have on those numbers and plan accordingly. Your finance folks should have that information. There's also information on the website that you can look at. Let's see. So just in terms of some data that you can use to kind of start planning, because we recommend, you pull a group together, you kind of look at your data to identify what you need based on what the community wants and what you're actually seeing in the data. You want those two things to come together. So some of the, the state has a lot of available data, one being the Bureau of Substance Addiction Services. You get information on like the number of overdoses that your town has seen, the number of EMS runs, how much naloxone you're giving out. You can do internet searches, just, seeing what kind of treatment programs, seeing what comes up in your program. So you have like a really good understanding of the landscape in your town. There's publicly available surveys, so your schools probably have access to the Youth Risk Behavior Survey to kind of see what's going on with teens in your town. And also, you can request data from Medicaid if you want to look at treatment or, particularly methadone use in your community, and then local data. So your police departments, your EMS, fire, those first responders usually have really great data on what's going on. So making sure you have somebody from that in your planning group, and they can be really helpful. And then, obviously, so this almost should be the first one, talking to your community members, because they know what's going on. And we recommend doing some one-on-ones, and also groups. We know that this could be a hard conversation to have in public, and because of the stigma that's around substance use. So make sure you have opportunities for either anonymous input or just more one-on-one individual conversations. I think I have maybe 1 or 2 slides left. Okay, so the BSS dashboard that I mentioned, you can get to it on this URL under here, and it has an option here to select your community. So you would do select, and then like a drop down would come up. You'd type in Fitchburg, and then it would populate data for your town. All 351 towns are accessible this way. So once it comes up, you can kind of see what does it look like for deaths. I mean, this here is, it's really sad to see that these numbers, and it can be hard to look at that. But it also, you need to know exactly where you are in the epidemic compared to, the state average. And you can also, like I said, get the emergency events, addiction. You can see how far do people have to travel, those sorts of things. And you can click on each one of those. That gives you a little bit more information. So just to provide some examples, there's hundreds probably that we could walk through, but here's just a quick overview, is that you could provide direct funding to support existing expansion of existing programs. So if you're fortunate enough to have a recovery center in your town, you could talk to them and see what do they need, what are they missing, what are their talk to the people that work there, but also talk to the people that use the recovery center. Mobile units is another thing that we've seen are becoming very popular. Those can either be for community outreach and harm reduction, or you can be more sophisticated and have a mobile treatment clinic. Not necessarily a treatment clinic, but a mobile health clinic that can go out and do a little bit more than just an outreach van. You could create a grant program for community-based organizations that serve. So if you didn't feel comfortable just sort of identifying an organization, giving them the money, you could create a grant program so that organizations describe what they're going to use the money for, and you can decide what best matches your need and the desires of your community. Could hire opioid abatement coordinator to manage this process. We recognize that, everyone already had a full-time job when these funds came in, and it can be a lot of work to make sure that you're using the funds appropriately and efficiently. So this is, depending on the size of your town, this could be a great role to share with maybe another town or two towns to have a full-time person that can manage this work. It's a great way to be efficient, but also if you don't already have like a nice task force in place, this person can help bring silos together and identify what sources you have, and really it helps. It helps when all the community organizations around are able to talk to each other. And there are also grant opportunities out there that have already come out to get more money in this realm. So if you had a coordinator that could put some dedicated time to finding grants and kind of building on the funds, that's also a great use. Transportation to treatment services, that's something we hear all over, not just in rural communities, but urban communities as well. For folks that need to get to, the treatment appointments, methadone, could be, daily or, 2 or 3 times a week, they have to get to programs. So finding a way to support people to get to places and to kind of help, reduce their cost to that. Could establish a fund for people with opioid use disorder or in recovery to help stabilize their lives. So it could be something simple like helping them get their license back, like especially folks that have been incarcerated. When they come out, they may have trouble with their documents, rental deposits, or even a phone. So there could be just some like basic things that people need to really help them get jobs and have stable housing. And then communication campaign is another one that you could consider spending some funds on. There are free resources out there, but maybe you need a little bit of money to get the word out to your town. You want to let folks know what you're doing and what's available. Maybe you want to have a community event, bring people together, bring all the resources together. And you could also have campaigns that help reduce the stigma and kind of normalizing treatment for folks. All right, I think I might have one more slide before. Nope, I think this is where I'm going to hand it over to Cheryl.
Thanks very much, Carly. And I'm going to go through these relatively quickly because I think Fitchburg has made a decision at least on some of their funds. So can you, next slide, please, Carly? So the state subdivision agreement, in the agreement itself, there is an encouragement to collaborate with other municipalities surrounding one municipality, and the Department of Public Health supports this kind of collaboration through MAHB when we are providing the technical assistance and legal education to allow municipalities to collaborate if they so choose. Next slide, please. And there are many ways that we can that can be done, and I'm just going to talk about. Carly, can you just switch the slide? These are the different ways that you could collaborate if you wanted to collaborate with other municipalities. And I'm not don't even need to use these slides right now, but what you might be interested in doing is maybe collaborating for one shared strategy that you may want to do with a municipality that borders yours or another municipality for whatever reason, where you would pool just some of your funds to do that shared strategy and maybe then do what Fitchburg wants to do on its own, if that's something that Fitchburg is interested in doing. And if you are interested in working with other municipalities, MAHB can help draft those municipal agreements. Obviously, your city solicitor's office has the ultimate say. We just provide the legal education. They would be the ones that ultimately would look at whatever the agreements are. So you may be interested at one point, as these funds go until 2028, in doing some sort of joint initiative with another municipality. So I think there's one last slide, which is just a resource slide, which, and these will be available, and you can just go on the CareMass website, just Google CareMass if you don't have this whole number, and you will find all of the information that we spoke about and much, much more, including expense reports. Those reports are public reports so that residents can see how money is actually being used in a municipality. And if you have any questions, feel free to email either Carly or me, or go on to this website or give us a call, and we're happy to give you any more information that you may have. One strategy that is being utilized in a lot of municipalities is to really look at hiring experts in substance use disorder to coordinate a lot of this work, and to hire outreach workers and folks that really understand substance use disorder, specifically opioid use disorder, and understand the concepts of harm reduction, which is a really important piece. We want to keep these folks alive until they're ready to go into recovery, and we frequently fail at that, and harm reduction strategies are designed to actually do that, to save people's lives so that they can get the recovery that they desperately want. And I will end with that and turn it back over to the Board of Health.
Well,
Carly, Cheryl, thank you so much.
yeah, I was going to say thanks very much, and that was very informative. I personally have a lot to learn about what Fitchburg is doing and how we might go forward, but gave us a bit of a pathway. I was just wondering, is there any organization or way that best practices are being summarized and can be copied? In other words, is there a town of Fitchburg size, for instance, or a city of Fitchburg size who maybe are down the road on this and have performed very well, and it would be a city that we could model ourselves after? Are those data being collected somewhere?
Yes, they are being collected, and Carly, you can jump in here. That is one of the goals and objectives of this CareMass team, is to share strategies that are best practices with other municipalities. I know Fall River is doing a lot of really good work. I know Northampton is. And that's something that you can ask of CareMass to give you some examples of best practices, evidence-based. And that's what this is all about, is we don't want to reinvent the wheel. We want to use what we have out there that we know works and that has been proven to work. So we can give you many examples. I'm saying we, Carly and her colleagues can, because they're the experts in evidence-based strategies. They can give you some proposals and some examples that are out there, not just in Massachusetts, but in other states as well, of evidence-based strategies that would work in Fitchburg.
Yeah, and I just want to add on here, because I realize I didn't really emphasize it that much in my presentation, is that the community involvement is really key, so that when you're developing an advisory group, you have to have people from the community that have been directly impacted by substance use in that work. And also you want to, a lot of towns have started off with doing like online surveys, or going into, like, say, the recovery center, or if they have a needle exchange program, talking to the folks that are using those services. You know, not always, you want to talk to the staff and the people that are doing the work, but you also want to talk to the people that are receiving the services. And you can pay folks to participate in interviews or do focus groups. We want to honor the knowledge that they have, and honor their time that they're giving. And also a point is that a lot of towns are really in this first phase of like planning. Like I said, there was some confusion about where the funds sat for a while. And I know that importantly, there's a lot of pressure on using these funds and not having them sit in accounts and not be doing, what they need to do. But we also want people to be thoughtful and not just rush and give the funds to the first person, the first group that asks them for the funds, or give them to a department that in the community that they just happen to be there first. So we want to make sure that thoughtful decisions are being made and that the data is being used and those conversations are happening before decisions are made.
And did this money come from, well, there's one famous family, this is where that money is coming from or has come from?
Well, that's a really interesting question. The money is coming from the manufacturers, the distributors, and the pharmacists that have all played an important role in this epidemic. The family you're mentioning, I believe, would be the Sackler family.
Right.
And that family has not yet reached a settlement. They attempted to put their personal liability into a bankruptcy for their pharmaceutical company, and the Supreme Court shot that down. So this summer, so the settlement with the Sacklers individually is still in the process. But yes, those are the types of defendants that have settled these cases with the attorneys general throughout the country.
And you mentioned a figure at the beginning of funds to come, and if I understood, that's going to come not just as a one-time give it now kind of settlement, but it'll be something drawn out over time.
Yes, over the next 18 years.
18 years.
14 years now, 2028.
So any programs that come out, I know the funding might change year to year, but at least can anticipate some support over a prolonged period of time, it sounds like.
Yes, and those estimates are on the CareMass website. You can look them up for what has been received up until May of 2024, and then what the annual amount is estimated to be for Fitchburg.
Right. Well, this is wonderful, and it's certainly a large problem, not only here, but around the world, really. And it's nice to see that we're making some conscious attempts to do better. Thank you.
So I have a question. Are we having this presentation so that we are going to possibly join in with CareMass and be a part of that CareMass program, and they are going to then be our advisors and help us to make decisions, or are we part of this presentation? Could you clarify that for me?
Sure. The services of CareMass are free to every municipality in Massachusetts. We are here just to provide technical assistance and legal education. Fitchburg will decide how they want to spend the money. We will help you with, we will comment on, if you want us to, on proposed strategies that you're looking at. We're here to assist you. So whatever you want to do, we want to help you make sure it's an evidence-based strategy, but ultimately the decision is with you. This is sort of unique in the sense that what boards of health and what public health is used to having is they're used to receiving grants from, say, the Department of Public Health or the CDC or the Department of Environmental Protection. And those grants come with deliverables that need to be delivered. In exchange for the money the state gives you, you agree to do X, Y, and Z. This is very different, as Carly mentioned. This money is coming directly from the defendants that were sued, and it's going right to the municipality. Your guiding document is the state subdivision agreement, because that lays out the policies that you as a city agreed to implement in Fitchburg. And there are, as Carly indicated, 7 categories with numerous strategies within each of those categories. So I hope that clarifies it. It's your decision how you spend this money. There are no contractual requirements with the Department of Public Health. There are only the evidence-based strategies that are in the state subdivision agreement, which Fitchburg signed on to.
So in other words, if we had an idea, we could take it to you and you might say, that's not such a good idea, it's already been done elsewhere, or that's a good idea.
We could, if that's something that you wanted to do, but again, we're not the ultimate arbiters. You know, we can advise you and say, this doesn't really seem to fit within the strategies that are in the state subdivision agreement. But ultimately, you know, the AG's office would be the ultimate arbiter of whether a strategy works. And I can give you a simple example. Buying a new police car, or for the police to use because they don't have enough cars. That would not be an allowable expense because that is not specific to opioid use. So those are sort of easy ones, but you just want to always go back to, is this supporting people with lived and living experiences? Is this supporting them? You know, paying for camp for grandparents who are taking care of their children who have died because of an opioid overdose, paying for camp so that those grandparents who can't afford it those kids could still attend a camp or go to a therapist. You know, we can walk you through a lot of those types of strategies. You know, paying for a consultant to help work on a media campaign, you know, someone who doesn't have any experience in opioid use disorder, probably not the best use of your money. Paying for someone who is an experienced person who deals with people with lived and living experience to help you figure out what you want to do, that makes sense. So it all depends on the relationship to those that are suffering in some way, shape, or form from opioid use disorder.
Right. And that's really what I meant, to utilize your services for advice, really.
Sure.
Yeah, I understand you're not going to dictate what we do, but give us advice, perhaps.
Yes.
Wonderful. Thanks.
I have another question. Does the city of Fitchburg already have somebody that is working with you? Is this something that's already been set up, or is this something that we're looking to establish?
We have just reached out to your health director.
Okay, thank you.
And he invited us to come and speak with you.
Great. Thank you. Thank you for being here.
He does lots of good things.
He sure does. I've known him for a long time.
Most of the time.
Most of the time. I do have a presentation, a quick presentation to make a proposal.
Did Ms. Wetchy have a comment? Let her do that.
Yeah, so several times I heard CareMass say that these opioid settlement funds should not be used to replace existing funding and existing programs. And we already have 2 outreach workers, and yet when I looked at the proposed use of the opioid settlement funds, you're looking to use the opioid funds to replace the existing funding for those positions. So it seems like, oh, look, here's all this opioid money, and you asked the outreach workers, what should we do with it? And they said, oh, let's fund ourselves for several more years into the future when they're already funded through another means. So that's directly against the guidelines that CareMass is presenting. I also think it's kind of perhaps premature to be voting on your opioid settlement funds budget today if you haven't had the community input that CareMass is suggesting. Have you gone to NA meetings? Have you gone to NAR-non meetings? Have you met with the Fitchburg Fire Department? I went to a Human Rights Commission meeting and they were asked what is the major challenge of the fire department, and it's not fires, it's dealing with all the unhoused individuals, many of whom have substance use disorder. So have you reached out and got this community input before you're rushing to approve this budget? That's another question that I have.
I think my president.
My understanding, and I'm sorry, I'll shut up after this, but my understanding, because we asked that specific question when we met with the health director, was that the outreach worker is currently funded only until, I believe it is April, because of the drying up of the ARPA funding, and that there is no other funding in the budget for continuing that person's job. That was my understanding. That would not be considered supplanting. If there were money in the budget that could be used for that position, that would be. But if the position is going away when the ARPA funds are going away, that would not be supplanting.
And you are correct, Cheryl.
Again, thank you very much. It's very informative, and I'm sure you'll be badgered by us and hearing from us. Thanks.
With your permission, I would do the short presentation if...
You have my permission?
I do.
Yeah.
I don't know what happens when I hit these buttons, but I'm going to try it. Try to share it with you. I apologize. I had it ready to go and now it's disappeared.
You're doing better than I would.
Well, we can always do it this way. Nope. Sorry, I had it ready to go, and things don't always work in my favor, as you know.
Well, take your time. If you're not able to do it, though, we can always postpone it. But take your time looking now, if you like. Just while you're looking, is this the presentation that you're looking for to update us as to the current status of this program in Fitchburg? And
We'd like to propose, show you what we've done so far and propose a budget to you.
Okay.
But it's definitely not cooperating with me. Try again.
I've never been able to figure out why I use my computer for a day, perhaps just shut it off and then go back the next day and it won't work or nothing's there. What happens?
Yeah, that just happened. Okay, I do have the presentation up.
Want me to assist?
Please, thank you.
I'll give it a shot. All right, all right, you've got that up there. I'm gonna get. Oh, I'm gonna get some of that.
Appreciate it, Dan.
That. Share screen. Share that. And then you've got that, and then you can. And there you go.
Thank you,
Then
sir.
you should be able to progress through it like normal.
Yeah. Yep. So,
Make us all feel bad, Dan.
make a quick presentation of the opioid settlement fund program and the proposal. I think Carly and Cheryl went over some of the strategies. I don't want to be repetitive, so maybe I'll skip over that if you folks are comfortable with that.
Well, perhaps only to the extent that Fitchburg is already doing some things.
Correct.
If we could, are you getting to that, or is that part of the?
Right, I just want to make sure that you have an understanding what the strategies are. They mentioned the harm reduction, they mentioned connections to care, support people in treatment and recovery, and then promote treatment of persons with OUD. We're also trying to support the needs of criminal justice involved persons, as well as pregnant and parenting women and their families,
Right.
as well as prevent the misuse of opioids and implement education support efforts to prevent misuse through implementation.
Right. Okay.
They mentioned also an advisory board. We are proposing and have the approval of Mayor Squire. She is intending on appointing an ad hoc opioid settlement funds advisory board. And the duties of that advisory board would be to analyze community priorities as well as make recommendations to the Board of Health and the mayor regarding funding allocations. So just really quickly, you did ask what other communities are doing. Worcester, the revenues are being allocated to the Health and Human Services Department, and they will be reviewing and assessing future appropriations to reflect real-time needs, and will be responsible for completing annual reporting to ensure they are expended on eligible uses. So they really are just getting going as well. Lynn has also received funding to the Public Health Department, and they have formed a 12-member working group comprising representatives from various city departments, medical providers, and individuals with personal experience to opioid use disorder. And they are also analyzing the community priorities and making recommendations to the mayor's office on how to allocate the newly obtained funds. Salem, their response to our request was that the health agent wrote that the city is in the beginning stages of strategic planning for assessing the community's needs and looking at a comprehensive approach to spending the funds. Fall River, I believe Cheryl mentioned Fall River. They have convened the Fall River Opioid Settlement Funds Advisory Committee, and they are tasked with providing recommendations on settlement fund spending. The 10-person committee is made up of local leaders, stakeholders who have experience with OUD, and also various Fall River institutions. And to limit conflicts of interest, which we also have a concern of, no committee member would be employed by an organization that would be a direct benefit of these funds. So, Ms.
Steve,
Wetchy.
could I just interrupt? Are these folks then volunteers who are on these committees,
Yes.
essentially?
Yes.
Yeah.
Yeah. To Ms. Wetchy's question earlier, yes, we have conducted surveys. These surveys were conducted at various substance treatment events, the Community Health Center Action Site, Restoration Recovery, the Community Support Center of Worcester County Sheriff's Office, the Fitchburg Interagency Team at their provider meetings, as well as upwards of 20 public Narcan trainings, and also 10 to 15 outreach collaborations. The surveys address the criteria set forth by the Massachusetts Abatement Public Survey, with funding was provided by Overdose to Action, which was a grant the city of Fitchburg received several years ago, OD2A. And these grants were completed with the emphasis on reaching people with lived experience. We also sought an evaluation from ICH, which is the Institute for Community Health, and they produced a report. And I know it's probably hard to see, but this is a result of those surveys. And I can share with those folks, but basically 3 categories of questions. The questions were based on access to services, harm reduction, and social needs. One of the questions on the access services are, do you think that access treatment and other services is available? And equally to all, 61% of the folks said no. Do you believe that race, wealth, and stigma play a part in access to services? 67% said yes. On the harm reduction, and this is really a tribute to what the city of Fitchburg has done with Keith Barnaby as our outreach worker and Sue Christensen as our outreach and prevention coordinator. The question is, do you know how to access naloxone or Narcan? 97% of the folks, or I'm sorry, 91% said yes. Do you think naloxone is available to all who need it? 60% said yes. Have you attended a naloxone training? 83% of the folks said yes. Are you familiar with the term harm reduction? 82% of the folks said yes. Are you familiar with the Good Samaritan law? 83% said yes. Can you name any harm reduction strategies? 70% said yes. Under social needs, is there adequate shelter in Fitchburg for those with opioid use disorder? 89% of the respondents said no. Is there adequate permanent housing for those with opioid use disorder? 96% said no. Are needs of these opioid use disorders addressed in the criminal justice system? And 69% of the respondents said no. Now, this is just a survey. More recommendations for input are obviously in our plan. We would be asking that the board hold a public listening session to hear from interested community members in a future board meeting. We will also be developing an online survey where folks can get access to qualitative and quantitative data, and to analyze that data, we would utilize the Institute for Community Health, just like we did to evaluate the surveys that we did at all the OUD events. So the city would be able to conduct more Narcan trainings. We would be able to continue on with Narcan distribution. We would provide education and distribution of fentanyl test strips. We would promote safe practices. That obviously is going to take a little discussion on where we go with that. That's usually politically charged. Education and distribution of wound care kits. We would like to be able to facilitate and continue to facilitate drug take-back days. We do offer two a year. We would like to educate about the Good Samaritan Act so that folks aren't nervous to jump in when there is an overdose nearby. And then, very importantly, we would like to continue to promote connection to care. And when we say that, it's not just go visit someone out in the field and hand them a phone number and say, hey, call this. It's a personal interaction, and Keith does that on a daily basis. He helps folks gather IDs or any information that they need. Obviously, you can't force somebody to take the information, but if the individual is interested in the services, we can provide that, as well as transport to an agency. We would also further recommend that the board oversee all the allocated settlement funds, including reviewing and awarding of mini grants at the recommendation of the advisory board that the mayor appoints. I'm calling it FOSFAB at the minute, but somebody might come up with a better acronym, but it was easier than writing Fitchburg Opioid Settlement Abatement Funds. So in this budget, we propose to continue to provide street outreach. Keith is also a harm reduction specialist. We would like to fund an outreach and prevention coordinator, which is an acceptable expenditure, as the MHB folks and Carly mentioned. We would like to start off small and provide mini grants, sort of a pilot program. That way we can partner with those agencies that are out there and help them get some funds that they may need. This budget would only include the funds that we have presently in our bank at the moment. As the ladies mentioned, we're going to be receiving 18 or 14 more years of that funding. So we look to, once we establish the mini grant program, we would obviously like to expand it once funds are more available and things are headed in the right direction. We would like to continue to contract with the Institute for Community Health for evaluation services of everything we do. We'd also like to work with the public schools, and this kind of goes nicely hand in hand with our MassCog coordinator and MassCog grant, which is to reduce access or misuse by our youth. We would like to establish a naloxone box program where naloxone or Narcan is more accessible to the general public. We would like to be able to hire a clinical nurse to work with the outreach worker and harm reduction specialist. It would be a partial funding of the public health nurse, which we would have to seek that individual. That position is currently vacant. And we also have some admin support overall to make sure that appropriate reporting and payroll and expenses are properly tracked. So basically, this is the 3-year budget. I just want to mention that this budget does include fringe and whatever folks do receive. There would be no city funds dedicated, but we would like to fund one full-time equivalent of a street outreach worker or harm reduction specialist for 3 years, which would be $225,000. Right now in the bank, we have $810,000 as we speak. So we're proposing to spend that over a 3-year period with these line items. Obviously, with recommendations from the mayor's committee, that is ad hoc committee, as well as discussions within the board. These things can be amended from time to time, but we do need to propose a budget to get started.
So there's $810,000 in the bank now. You said we want to use that over a three-year period.
Period, yes.
But each year between now and those 3 years, we should get some additional funding, is that
Correct.
it, to replenish?
I believe funding goes through 2038.
Yeah, but we don't know what it involves or what
Actually,
it is each
we
year.
do, well, there is a document that states what the city of Fitchburg can expect up until 2038, but we're only looking to baby steps to start. Over time, we're leaving the future open to make changes to where attention needs to be sent.
I think it was mentioned we should only spend the money that we have now, not commit
Correct.
to future expectations, which may or may not come.
Right.
Yeah.
Right. As I mentioned, the mini grants, we'd like to fund an outreach and prevention coordinator, only a part-time position to start. That person would oversee the full-time street outreach person, as well as also oversee our mass call grant, and to make sure that all the funds are being utilized for the purpose that they're established, as well as kind of overseeing the umbrella of the whole program.
What does the street outreach person do? I mean, how does that person function?
The street outreach person actually drives out to where our sites are, our homeless especially, is I don't want to be stereotypical. Not all homeless folks have addictions. Many of them do, high percentage. The street outreach works very closely with these folks on a daily basis, goes actually out and visits them. For the past 5 days, I should mention, we've had a warming center. 20 to 25 folks have been visiting and staying over at the senior center for the last 5 evenings due to the below freezing temperatures. So our outreach worker and our coordinator are present in the warming center all night long, working with the individuals, trying to get them to connected to needed services. So it's really handy to have the warming center because they're coming to you. But he actually goes out in the field and finds these individuals out there and tries to connect them to needs. He's a strong advocate of getting them IDs so they can at least make that first step to whatever service they need. He also works very closely with the clinician from the Fitchburg Police Department, so when there is an overdose response by the police department, he gets involved with those. As much as he can get himself out there, he does. I think he does a great job of it, but he also conducts harm reduction trainings, and he is a recovery coach, so he provides many trainings, and to those who have family members that need assistance, recommendations, and training on how to deal with a relative or close a loved one that does have an addiction, how to prepare yourself when emergencies arise. It's really a blessing to have Keith and Sue in the program, and I'd like to be able to continue that as long as we can.
Sounds as if he's someone who can be trusted or develops trust with those he's trying to help, which is important.
I've actually gone down to events where Keith has had a crew. They respect him quite a bit. There was about 10 or 12 unhoused individuals. They were down at Riverfront Park. We were holding an event the next day. This was a Friday, and there were concerns from residents that the event was the next day, and there was issues with trash, and I believe there was a tent down there. And he actually, I was impressed. I witnessed it personally. He actually pulled them all in, talked to them, said, "Hey, can we work together? This is our park too. This is your park. Let's make it presentable." And I witnessed it, they all listened to him, and they all grabbed a bag, and they all helped out and filled the city dump truck full of trash. So it was an impressive thing to watch, that he's actually earned the respect of a difficult population.
Yeah, great. And one other question, sorry.
Sure, no problem.
Is there kind of a category within this budget that would keep some money for unexpected or unanticipated needs, things that might come up, or does this take up the whole bank account that we have?
This basically takes the funding that we have now.
Yeah.
Whatever, we hope that the needs will be addressed by the mini grants as well as incoming funding over the next 14 years.
Yeah.
But I mean, many of these items are expenses. We don't necessarily have to do that. If the committee and the board doesn't want to do the nalox box pilot program, that is not something that we're required to do, but it is a harm reduction. So, I mean, there are the ability to substitute. So I guess what I'm saying is that there is expenses. We've tried to appropriate them to show the goals, but I guess that this is not etched in stone.
No, I understand, yeah. No, I just thought, if some major breakthrough occurred, would we have a little extra money to participate? I saw one city, I can't remember which one now, but has naloxone available in vending machines now.
Yes.
People can, get it fairly easily if it's needed.
And that is definitely a program of the nalox box pilot program.
Yeah. Yeah. Right.
So, as I mentioned, the nurse manager would be funded part-time for the next 3 years, and then we would throw in some admin support so that financial reporting is taken care of appropriately. I tried to make that as quick as possible, sorry.
No, in listening to what all these presentations have said, it seems that there's a lot of work to be done, and it's, I think those who are spending a lot of time on it do deserve to be compensated for their time. I mean, it's not 2-minute work, it's,
right.
There's a lot of work involved, and it's important work.
I know Cheryl did mention pooling of funds through our Public Health Excellence Grant. We did throw it out to the Montechusett Public Health Network. The idea of pooling funds, that idea is not dead, but many of the funds of the cities and towns had already committed to whatever program there was that they had in place, and also many of the communities in the Montechusett Public Health Network are smaller communities that didn't receive much funding. And many of them didn't even have an idea of how much funding and where it was. So we figured that once we got ourselves organized, we would then go back to the Montechusett Public Health Network once things are moving in the right direction, and we would once again propose to try to pool funding and whatever it is that the goals are for the other communities. Maybe they're similar to ours, and maybe we can work together to tackle, for example, the housing problem.
Yep. Shared programs, yep.
Steve, can I ask, when you say you've put this plan together, who are the people who put the plan together if the advisory committee, the advisory board is not in place yet? Is this the board of other members in the Board of Health who have put this together? Or
the ad hoc committee would be appointed by the mayor.
Right.
Yep.
So that hasn't happened yet?
I don't believe so.
Okay.
We did propose this to the mayor a few weeks ago. She may be working on it.
When you
I
say
haven't
we,
discussed it with her.
Who is we?
I'm sorry. We being myself and
Okay.
Sue Christensen
Okay.
and Keith.
Okay,
I
that was what I
apologize.
was wondering. No problem, I got you.
So it was you who came up with this, in
Yeah.
other words, is what I think she's asking.
This is 99.9% Sue Christensen that put this pros together.
Yeah.
And I want to thank her for that because it's well thought out.
It's a lot of work. Another comment?
So if you go back to the survey that you did of the community, the vast majority, like 80 or 90% of it's in bright red, that one, like 80 or 90% of the people said that their need is for housing. And I don't see anything in your budget for sober living housing. All I see is government salaries and government benefits for government employees. I don't see the housing for the people in need, many who have been displaced by the migrants. There's limited affordable housing in the state. We have a housing crisis, and these people need help, and I don't see it in your budget.
So to quickly answer that, there is no quick answer to that right now. And we hope with traveling through this program, that might be an issue with other communities as well, and maybe we can pool our funding to work together to solve that similar problem. But presently, we don't have an answer to that, which encourages the mini grants. Hopefully, somebody out there has a proposal that can be funded by the grants.
You want to write one, Ms. Wetchy?
Sorry?
Would you like to write one? Request for a mini grant?
I
for
already
housing?
have a full-time job.
Well, so do we.
Again, this proposal doesn't solve all the problems. We are hoping that as the program grows, whatever problems that pop up, we'll find a way to address them.
I'm saying the focus is misplaced. The
Gotta-
focus.
I didn't expect you to agree
The
with
focus
it.
is misplaced because the focus is on the government employees rather than the people in need and their families.
That's one person opinion.
Well, thanks for the comment. Guess I'll leave it at that. So, are you asking for our approval of this?
If you're comfortable with it, if not, we need to do more work. I'm all ears, but I would like to be able to move forward with it. We would likely do a presentation for the city council. The appropriation by the council has already been done, so it's not really necessary, but if the word doesn't get out there through this meeting, then a very similar presentation would be provided to our city council.
Yeah. And I do appreciate Ms. Wetchy's comments, and I would agree that housing seems to be a real requirement for these individuals, somewhere that they can be safe and have some ability to begin recovery. But I think, and that's in part why I was asking, are there funds that perhaps haven't been allocated that when these things come up can be used? But I think you answered that by saying that there are many grants available, so, and also opportunities for pooling with other cities who are nearby, perhaps to help propose housing. So certainly something that's important. I think we're aware of it, and but I think there are beginnings there to address that problem. Well,
I have one more question as far as housing goes, and that being a major issue. Would it be possible for, I'm just going to go out on a limb, and I'm going to say there's like a building or a church or a place that could be used for housing of people who have substance use disorder. Would that, whoever is running that church or facility, would they then be able to apply for a mini grant to provide housing? Would that be an opportunity?
That would be an opportunity, yes. And the
Okay.
board, at the recommendation of the mayor's subcommittee, the board would be the ultimate approver of that. So all the applicants, you as the board would be the ultimate authority on who would be subject to the funding of those grants.
Okay.
With your approval, of course.
Well, I would, anything else that you want to?
I don't think I have any more
Excuse me.
questions, no.
I think then I would make an motion to approve this, this budget with the recognition that there may be some changes coming.
And I would second that. And so now that we have made the motion, we've seconded it, then now it goes to the city council, or,
So you are the ultimate authority. So it doesn't have to have any more approval.
okay.
So what we will do is we will meet with the auditor, establish a budget, and we will get the ball rolling on, our next step would be to, I would think, put the committee together. I was supposed to share this with you.
Did they, I'm sorry to interrupt. Did they vote?
We did.
Yes.
Oh,
We only have 2 members tonight.
But we were the majority, so. I'm personally pleased to see that we're moving forward so well. I've learned a lot today, and appreciate everyone's work to get all this together. And I know it'll need some tweaking and some changing and response to needs as they arise, but I think represents a good start.
Again, I can't thank Cheryl and Carly enough for their assistance. We will be working very closely with them on this project.
Maybe I'm just going to ask a question, maybe it's not an appropriate one at this point, but what kind of numbers are we talking about here in terms of individuals who reside in Fitchburg who are struggling with this problem? Maybe I'll put it that way. Do we have any idea of, I mean, is it 20 people? Is it 10,000 people?
Yeah, currently, we estimate that our outreach individual touches, I'm taking a stab at the numbers. I wish I would have read the reports a little more closely, but he meets probably 30 to 50 people a day.
Okay.
Yeah.
Oh my gosh.
So,
It's huge.
yeah.
Not the same people every day.
Well, there are duplicates.
Yeah.
Of course.
But still, wow.
And one other thing about Keith is that he is available to probably everybody that he meets.
Right.
He's got his cards, he is available with just a phone call, and he's very quick to respond to anybody who needs it. So I think him and Sue are doing great work. They're doing the best they can in a really, it's not an easy situation. There's no quick answer.
Yeah. And CHC Action has breakfast and the ability to shower, and they provide some medical assistance if needed every morning. So many of our clientele attend that. So he's available every morning and works with them, because it's a great place to
Kind of catch up to people.
To catch up to people, yeah. You know, necessarily, you don't have to go necessarily looking for them out in the field. They're all in one place, so it's nice to get what you need done. But again, that's just an estimate.
I'd like to just jump in real quick. I took a look at that dashboard, and it looks like you have 460 individuals that have been using BSAS addiction services. So that could be folks that are on methadone, or folks that are using buprenorphine, or individuals that have gone to detox. So that's kind of a number to consider. You've had, I think, was it 36 substance-related deaths, but 20 of those were opioid-related. So that's actually quite high of a rate for the state. And you had 105 opioid-related ER visits and 153 opioid-related EMS visits over a period of a year recently. So, and those are just the folks that are kind of like hitting the system. Of course, you're going to have all the families of those individuals that are impacted by this, and folks that are, in recovery that are still at risk, but they may be not in those numbers. So I do think this is, really important issue for you guys to be addressing. I liked the kind of mix of things that were in that budget. And I actually just had one question. The clinical nurse that was on there, is he going to be going out with the outreach worker to kind of do wound care and things like that, or would they be based in an office setting?
That was the idea, is to assist the outreach worker, especially for wound care. Yes.
That's excellent. We've seen that be very powerful in other communities.
Excellent, thank you.
And this is all opioid trouble. It doesn't include other substance abuse problems. So it's a sizable problem.
Okay.
Well,
thank you for your time.
Thank you for all the work you did, putting that together, Steve.
Thank everyone for a very informative time here. Appreciate it. Well, that, I think, concludes the opioid hearing. And elsewhere on the agenda, did the other petition request, that's on hold, I think, for...
Do you have anything to add to that? That's on hold. I know Tobacco Control is still providing education. I haven't talked to Tobacco Control in a few weeks, but she still had some individuals that she was working with. She's approached, as I mentioned in a previous meeting, she's approached them all on one by one. They weren't really interested in having a set meeting in a set place. So I think we can move on to the council petition. On that issue, I will say since our last meeting, we've only had, I believe, one complaint. That was on the 30th of December. I did go out on the complaint, and I didn't notice, because it was several hours after the complaint, I did not notice sewer smell. But I can make a comment that the city is working on contracting with a third party to investigate. It'll be an odor specialist. We'll be investigating the odors and putting a program together. One of the reasons why I was late coming to the meeting is that meeting was going on. So I don't know the final details. I had to walk away, but I will have much more information for you. But we hope that this individual will help with reducing odors in West Fitchburg.
Yeah, and I think Greif published for us a little 4 or 5 page document on the efforts they've made, which are tremendous. And we visited out there, and I think certainly there's a kind of a wet paper odor there that's just part of the process, but I didn't, at least after spending 3 or 4 hours out there, I didn't detect any sewage odor, so I'm just wondering, I did go down and park at the treatment plant one day. I couldn't get right in because of they had the gates locked, but I did detect kind of a very faint odor, so I'm just wondering if it's the odor is coming from somewhere different other than Greif anyway.
Yeah, the odor that has been a sewer odor, which is definitely different from the Greif process.
Yeah. Well, we'll continue to try to get to the bottom of that, and it does sound at least as if in the last month there have been less of it, so for whatever reason it's doing better. Well, beyond that, we have approval of meeting minutes of December 5th. I don't know if I saw meeting minutes of December 5th. Did we get them, or?
I believe I sent them last week.
Oh, really? Well, maybe I just missed them
That's okay.
somehow then.
Nope,
All
no
right.
problem.
I have a question about the odor specialist. That the city then is, if I'm clear, the city is going to be contracted with somebody to come in who can help us to further determine what exactly is going on?
Correct. And yes, we'll hopefully make recommendations on this individual is a specialist, has 30 years experience with investigations, and it's nice to have a neutral party step in to help with the investigation, and has 30 years experience, as I mentioned, as well as I didn't get to see the equipment. He was just about to get to that when I had to get up and leave, but definitely has some equipment that have not been able to have available to us.
So to alleviate the concerns of the residents in that area, is this something that's going to be happening like that time of the year in the winter, or is this is that been
I think we're going to
determined
work together with hopes that we reduce them to near zero, if not zero, as well as be prepared for when the warm weather comes. Should the warm weather have a factor in the odor problem?
So this person is going to be then arriving or coming around to do his job relatively soon?
Yes, that's the goal.
Right. Phew.
Yeah, they're actually, I think Greif hired them too. They're people who just specialize in odors and can detect, they have better noses than most, I guess, so it might be a person like that.
It is definitely subjective.
Yeah. Okay. Well, as far as the meeting minutes go, I guess I missed them somehow, and so did you have?
I wasn't here, and I did not read the meeting minutes from last month. So
Maybe
we can hold that and look at it before our next meeting.
Table that to the next one, yes, thanks, I'll look for those. And lastly, regulations, was there something, or?
Everything has been tabled. I didn't come prepared to present on any of these issues because I thought there was enough before you already.
All right.
And I do have one announcement.
Okay.
It looks like tomorrow from 9 to 4:30 we do have a flu and COVID vaccine clinic here at Fitchburg City Hall, 718 Main Street. It's not too late to get your annual flu and COVID vaccines. So we have flu vaccine for ages 5+, as well as COVID vaccine for ages 12+. It's a walk-in clinic, and if folks need to have any questions or have questions answered, you can call 978-602-2356. And someone will assist. We ask that you Bring your insurance card if you have one. We will not refuse if you do not, but we hope that you will bring your insurance card if you have one. And again, that's tomorrow at City Hall from 9 to 4:30, 9 a.m. to 4:30. And I believe that's on the third floor, Catherine? First floor, my apologies, first floor. So as you walk in the lobby, the clinic will be visible. And Catherine is one of the vaccinators at the clinic.
Yay,
So
Catherine.
we appreciate her services.
She sat here this whole time to hear that.
Thank you.
You had mentioned the norovirus.
Yeah, if you, I don't know if you need any assistance, but
Well, just, I think you had brought up the fact that we're seeing a fair number of cases of what's presumed to be norovirus in Fitchburg. I think it's not only here, but across the country and across the world that norovirus is a very common, if not the most common cause of gastroenteritis, or essentially nausea, vomiting, diarrhea, belly pain, gastric type of upset. Fortunately, it's usually short-lived, lasts a day or two, but people can be pretty ill with it and get dehydrated. And I think I read somewhere there were 200,000 deaths across the world last year just from norovirus, and a lot of it has to do with dehydration. There's no real vaccine for it. There's no medication for it. It's a virus, not an antibiotic, or not a bacterium. So antibiotics are not helpful. So the best way is prevention. We see more of it during wintertime when people are cooped up and together, but it usually requires swallowing contaminated material. So it's usually that food gets contaminated. It comes either from oral or from fecal contamination. So hand washing by those who prepare food and those who are eating it is very important to prevent it. Again, usually it lasts just a couple of days, so if one stays well hydrated, most folks are going to get over it without incident. But in people who have other illnesses, older folks or young children, if they get ill enough, it can become a serious problem and even require hospitalization. But it's not one specific virus, it's a group of viruses, so there's unfortunately no vaccine for it as yet. So just the usual stuff, wash your hands, be careful what you eat, and hopefully you'll be free of it.
thank you, Dr. Eaves.
And if you're sick, stay home.
Right. Yeah, they do recommend that if a person is thought to have it, that he or she stays away from work for about 72 hours after feeling better to prevent spreading it. It's a fairly contagious illness. Good enough. Well, unless there's anything else, I think we can adjourn the meeting.
I would second that.
We're adjourned. Thank you.